more people are dying from legal prescriptive medication than they are from cocaine or heroin and some of the other things that we call bad drugs.
These drugs can certainly help us. We're living longer and healthier lives than we have in any generation prior. But any drug, even if taken appropriately, has a downside. And when we start misusing and abusing, that escalates quite quickly.
As a person recovering from prescription drug abuse addiction, I think that they're fairly easy to obtain through the doctors, and then I think that what happens is it's very easy to justify using prescription drugs because it was prescribed by a doctor.
This is a complicated issue, and I think it's one of those issues where you might say it takes a village to make a difference.
It's a multi-level problem that we need to address, not just from law enforcement, but from other areas as well.
It truly is incumbent upon us to create the awareness so that we can look to provide solutions.
Prescription drug abuse is a serious problem that affects people of all ages and communities across the country. We're going to talk with three people who have a lot to share about this issue. Kristen Frederick is the project director of the Ohio Center for Coalition Excellence at the Drug-Free Action Alliance. Tony Ashton is the director of prevention at Works for a Drug-Free Fairfield County and co-chair of the Fairfield County Opiate Task Force Community Education Committee. And Orman Hall is director of the Ohio Department of Alcohol and Drug Addiction Services. Orman, let's start with you. This requires a multifaceted approach.
Opiates are a huge problem across our state right now, unfortunately, and I think that it does require a community-wide effort in order for communities to move forward and to overcome the problem of opiate addiction. And what we found is that when you can bring healthcare providers, other human service professionals, criminal justice professionals, and treatment professionals to the same table, that you can make a profound difference by coordinating all of those efforts.
Tony, is that something you've been able to do in Fairfield County? Do you have all those people at the table?
We do have all those people at the table. We were able to start talking about the opiate issue in our county at the end of around November of 2009. And we had some very forward-thinking individuals in our community that were able to come together, key stakeholders in our community that were willing to talk about the issue and to start building some solutions in our community.
Do all these people, were they aware of the problem, the severity of the problem, or are some places more tuned into this problem?
Obviously, some places are more tuned into the problem. For example, law enforcement was very tuned in. Our jail was very tuned in. So certain places had that information, but we were able to educate a number of different people. We had a summit that about almost 100 individuals in the community came to listen about the opiate issue. We were also lucky enough to have a locally produced documentary regarding opiates in our community that we were able to show people and raise awareness in that way. And through that effort, through that summit, to be able to have people to actually sign up and be a part of our task force.
Kristen, it's a multifaceted problem, but it's also a multi-age problem. So I imagine you have to develop resources for both senior citizens who may be touched by prescription drug abuse, then also teens and even youth that might have issues with this problem too. Is that correct?
That's right. And what we try to do is bring together all the resources that are already out there on a national level that address opiate abuse and prescription drug abuse across the lifespan. So for example, Community Anti-Drug Coalitions of America has a very comprehensive prescription drug abuse toolkit that communities can use to help all sectors of the community address the problem consistently and in a very strategic manner. There are other toolkits available out there. For example, the Generation RX toolkit, which was developed by the Ohio State University College of Pharmacy in partnership with Cardinal Health, which addresses prescription drug abuse among young people and also among college students. And there are other national resources that are available out there that we try to connect community coalitions with.
So if a coalition is important in addressing this problem, what gets in the way sometimes of putting these coalitions together?
I think sometimes communities are maybe a little overly simplistic about the complexity of the problem. In many instances, those coalitions that may not have been quite as effective as they needed to be will focus on one aspect of the problem as opposed to looking at the broader scope of issues that they need to be dealing with. In some instances, there will be maybe too much of a focus on community education, which is critically important, but it's not the only thing. So if coalitions can step back and take that broader approach, if they can integrate all of the major players that need to be at the table, I think that's where tremendous progress can be made.
So we've talked about the importance of getting a lot of people at the table. What do we need to have these people doing now that we convened them? What are the action steps?
Well, I think one of the really important aspects of a coalition is you have multiple stakeholders holding each other accountable for making sure that everybody's taking appropriate action. By having all of these people around the table, it creates opportunities for dialogue and for a degree of synergy around issues and topics that you don't always get when you have them acting as individual players.
Kristen, we've been talking about Fairfield County, but there's other places in the state that have had some interesting and successful strategies in dealing with this problem.
Yes, Scioto County in southern Ohio had a very grassroots effort into addressing opiates and prescription drug abuse in their area. Very severely impacted county in the state of Ohio. It really began as a victim advocates movement in Scioto County because so many families were directly affected either by a family member who was an addict or who unfortunately had passed away because of their addiction or their use. So as a result of that, certainly there was a great amount of passion around this issue.
The other thing that they did in Scioto County that was remarkable is the health department there declared opiate addiction a public emergency. I think that's the only place in the country that that's been done, and it did create quite a stir.
So do you have advice for communities that haven't started about where they should begin if this is a problem that they want to address?
I would say you begin at the beginning and you get those people together that have concerns around the issue. And as you start to form a coalition or a task force, other people will join the effort because it does affect lots of people. It affects people either through family members with addiction, either through family members or themselves with crime, because the addiction does lead to crime, that if you form a group, people will respond to that. And I think there are always helpful, like the coalition, statewide coalition, to be able to help groups get started, to provide technical assistance, that's available.
Kristen, do you have advice for somebody starting out?
Sure. Well, there are a number of coalitions that are already moving very quickly on this issue and in a very smart way. And in Ohio, we have a statewide prevention coalition association. So because there are a number of coalitions already out there that have been doing this type of work for some time, we can also pair new communities up with more experienced communities so that there's sort of a mentoring relationship between that new coalition effort. And then that new coalition can begin to see and learn from the coalition, learn lessons, what to do, mistakes that have been made, that they don't have to make those mistakes because the coalition has gone before them. And I also think it's you know, after you get all those people together that really have a passion around the issue, to do what Fairfield County did, and that is make sure that you have the data to support what you think your problem is, because sometimes communities sort of go on their gut, and that is what they think the problem is, and sort of get misguided. So it's really important to have that data in front of you so that you can make smart decisions on how to work with each other within the community and develop strategies that make sense and will work within your community and will work with all different kinds of populations within your community, because not one message works for everyone in the community.
I do think there has to be something that sparks the process. It either has to be data, there has to be some sort of event like a number of overdose deaths that occur in close proximity. Something's got to create the energy and the sense of urgency around this issue in order for people to unite and to move forward. In Fairfield County, it was the data. In Scioto County, it was the understanding that there were pain clinics in Scioto County that were acting inappropriately. So if you don't have a sense of urgency, it's not likely to work.
This Fighting Prescription Drug Abuse resource was developed with the support of the Cardinal Health Foundation.